Be you patient, physician, hospital administrator, IT professional, or academic, no surprise, healthcare has changed. And with the industry's radical transformation, the critical need for accurate and precise information delivery to patients has become paramount. Clearly, as medical breakthroughs continue and physicians' time with patients become more structured, technology must play a role in successful patient outcomes. Greetings, everyone. It's Tuesday, May 13, 2014, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. Up to the Tech Talk, a TAG Top 40 Most Innovative Company in Georgia, and the Southeastern Software Association's Impact Award winner, Bioscape Digital, Atlanta-based startup that has staked its claim on the future of patient education by innovating new media digital technologies, enhancing the patient experience before, during, and after medical treatments, all through interactive patient-centric technologies. Tino speaks with John Hammer, Chief Marketing Officer for Bioscape Digital. John leads product management, marketing, and strategic business development. He has spent the last 17 years guiding innovative technologies to market in startups and big companies alike, in product leadership positions at CBion, iWonder, and Vario, as well as technical and strategic roles at CNN, Bank of America, the Home Depot, and others. It's all about a robust solution that utilizes video, interactive elements, 3D modeling, voice and graphics, combined with patient resources, real-time patient stats, and even insurance calculators and referral management tools, and health screening signups and patient education, and oh yes, games. No surprise healthcare has changed. One reason is a healthcare IT game changer based right here in Atlanta, as Tino Tech Talks with John Hammer, Chief Marketing Officer, Bioscape Digital. This edition of Tech Talk is brought to you by GlobalSpeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of GlobalSpeak.com, creatively delivering powerful marketing, video, and audio solutions.
John, thank you for joining me on Tech Talk today.
Oh, thank you, Tino.
So let's jump right in. Best place to start is, what is Bioscape Digital Wellness Express platform?
So the platform is a tablet-based patient engagement solution, which means that patients get to use it in the ER, back in the treatment room. So imagine you're going to the ER for whatever, you get checked in, they take you back there to see a doctor, and there's this tablet hanging on the wall, and it's got all kinds of content for patients to either kill time, answer questions they may have, give real-time feedback back to the nursing staff and the hospital staff there, find out what kind of insurance they qualify for under the Affordable Care Act, stuff like that. It's very compelling, and our hospital customers really love it.
And is this new to the market?
It is. We've been in hospitals now for a few months, probably close to a year, actually, a year and a half. We've been expanding a lot recently. We've got some very beneficial relationships that have allowed us to get into some of the larger hospital companies in America. And obviously this year, the reason you and I are speaking is we won both the SSA Impact Award and we were a top 40 tag innovative company. So
right. Well, congratulations. Those are both very competitive. So congratulations for winning those competitions, being part of those competitions. So, can you tell more about the factors that led to Bioscape's, the solution that you guys are providing? I mean, I certainly know, I think our listeners know about electronic medical records and what's changing in that area, and I guess it's moving pretty fast now, finally.
It sure is, yeah. A lot of this is due to the Affordable Care Act, or Obamacare, as folks like to refer to it, and what is called within that meaningful use, which means you don't just have to pay money for an electronic medical record system, you have to actually get meaningful use out of it, which means people signing up for patient portals, all kinds of things like that. But what's really impacted our hospital customers, and some of your listeners will know this, is this reimbursement rate changes based on things like readmission rates or patient satisfaction after the fact. And so hospitals are trying to get their hands around this, but because of the way legislation is frequently written, they're trying to address the legislation, not necessarily address all the core problems. So what we're trying to do is help them do both, meeting the goals of that legislation as well as coming at it from a patient's point of view and helping the patient have a better experience when they're in the hospital.
And I imagine there's some challenges in rolling this out. What kinds of things are you facing in the way of challenges?
Yeah, definitely. So, many TAG members are small businesses, and they all certainly started as small businesses, and so they can relate to the kinds of challenges we've had as we grow. It's managing our resources and making sure that we're applying the correct force to the right problem at the right time. With all the hospitals coming at us right now, it's figuring out ways to prioritize, how to execute upon all that. As I mentioned before, we have some relationships with some companies that got us in the door at a lot of these hospital companies, which has been very helpful, but it also means, more balls to juggle.
Right. Well, once you roll this out and there's good adoption rate, are there some next steps in terms of, expanding the business, like I would say horizontally with new products or new offerings?
Yeah. So the cool thing about the solution is hospitals in general just want to have one patient, device on the wall if they're going to have any. So it's kind of like a market share play for us right now. And then once we're in, and our entry point right now is the emergency room. So once we're in that emergency room, the next logical step is to go throughout the rest of the hospital. And obviously the challenges in the other hospital rooms are different than in the ER. You stay in the ER for an average of 4 hours, you stay in the hospital for an average of 4 days. So there's a lot more opportunity for content that is appropriate in that market. But then there's other things like patient engagement, patient portal sign-ups. Some of our hospitals want us to do so that patients can access their medical records online, which is very helpful, ask their doctor's questions, stuff like that. We're trying to be careful in the way we grow. We don't want to grow too fast for our britches, so to speak, but we are hiring right now. We are looking to bring people on the team to help us manage this growth and help us grow at a nice, good clip as soon as possible.
And obviously,
one of the other things.
Go ahead.
So thanks. So one of the other things that happened with us earlier this year is we merged with a company called PictureRx, which came out of some research at Emory University and Vanderbilt Hospital. And the next phase of their growth, the next phase of their research, I should say, was putting a medication history application in the ER so that patients could get a more accurate medication history taken when they go into an ER. And since we were already in the ER, it was a natural match for the two of us to come together. And so executing on that grant is obviously one of the high priorities we have going forward.
And final question, I know our listeners want to hear this. So you're obviously headquartered in Georgia, and you're growing jobs here in Georgia. Is that the long-term plan?
It is, yeah. We want to stay here in Georgia. I'm a native Atlantan, born and raised at Piedmont Hospital there. And the rest of the team is firmly rooted here in Georgia. So we're excited to be able to grow the technology scene in Georgia, be able to be a part of this extremely vibrant community. And TAG's a huge part of that, and I've been involved with TAG for a long time, and I really appreciate all the work you guys do. So,
well, thank you for that. And on that note, John, we have to end the conversation. But thanks for joining me on Tech Talk, and all the best in growing the company moving forward.
Thank you very much, Tino. I appreciate it. It's been a real honor.